The thyroid gland is a butterfly-shaped gland in the front of the neck, and the parathyroid glands are small, usually 4 in number, but that can vary, that sit behind the thyroid gland. In the case of the thyroid gland, it controls the metabolism of the body, so it has multiple complex functions. In the case of the parathyroid glands, they control calcium metabolism, so they specifically maintain the calcium level within the bloodstream that the body needs. Because you need normal thyroid hormone levels for all areas of metabolism, abnormal thyroid hormone production can affect every system in your body. It can cause heart problems, it can cause cardiovascular problems, digestive problems. What we deal with actually more is when a person develops nodules on their thyroid gland. Those nodules can cause symptoms such as difficulty swallowing, in some cases even difficulty breathing, and in worst case scenario, they can represent a thyroid cancer that has to be treated, or it can become very serious. Most people who have thyroid nodules do not have symptoms, so it's very important to see your doctor regularly to have your thyroid examined and for he or she to determine whether or not you might need a blood test to check your thyroid hormone levels. Thankfully, thyroid cancer actually has one of the best prognoses of any cancer. Of course, it is a life-threatening condition in many cases, but in most cases, 90% or so, it's a completely survivable disease, particularly if it's caught early and treated appropriately. There are always exceptions, but that is true for the majority of types of thyroid cancer. If a patient has thyroid surgery, it begins with a sometimes outpatient, sometimes inpatient operation. After the surgery, people will have some pain and discomfort that limits their activities, but the recovery only takes a few weeks. After that, they're back to their normal physical routine. Because we have a way to replace the thyroid hormone in the body, there should be no long-term adverse effects from removal of the thyroid gland. One of the more common complications, although not too common, is damage to the nerve that controls the larynx. We are experts in treatment of the voice and the larynx, the voice box. That is something that general surgeons are not trained in at all. So we have that capability of managing the entire neck, and including the potential complications from surgery or thyroid cancer itself.